Welcome everyone, and I'm here to present the progress of my PhD, which will focus on the neurocognitive development of children with perinatal insults. I'm Dóra Bodócs, a cognitive psychologist and also a first-year PhD student, and together with my team, we are working together to achieve our vision, which is to give every child a chance to speak on time. And within this vision, our current mission is to reveal the early indicators of language difficulties and its connection to perinatal insults. So currently I have two ongoing projects. Both of them will focus on the prognostic accuracy of different biomarkers in children with neonatal encephalopathy. In the first project, we will focus on the global neurodevelopmental outcomes, and in the second project, we will specify our research interest to the language development of these children. So let's start with my first project, investigating the prognostic accuracy of different biomarkers for detection of neurocognitive deficits in children with neonatal encephalopathy. So perinatal asphyxia and the resulting neonatal encephalopathy affect 0.5 to 3 per 1,000 live births in high-income countries, and it's one of the major causes of mortality and neurocognitive deficits. The late diagnosis of these neurocognitive deficits can lead to learning difficulties and poor social growth, which can make it harder for these children to achieve their academic goals or maintain their social network. Currently, there is no such biomarker which can predict the cognitive skill sets of these children at the age when they attend school. The early accurate predictors and the intervention based on these predictors would result in a better and healthier developmental trajectory of these children. Based on these pillars, our current aim is to find the most accurate predictors for predicting neurocognitive deficits in these children. So our clinical question is that what's the most accurate predictors for predicting adverse neurocognitive development in children with neonatal encephalopathy? Our population is children with neonatal encephalopathy, and the prognostic factors that we would like to investigate are the MRI, the amplitude-integrated EEG, the MRS, NIRS, and the blood gas markers. The outcome that we would like to investigate is the prediction accuracy of the general neurocognitive deficits. Based on our knowledge, our hypothesis is that the amplitude-integrated EEG and the MRI will be the most accurate predictors for predicting adverse neurocognitive development. We hope that our results would lead us to early predictors and intervention based on these predictors. So here you can see my search key, which can be divided into 4 domains. The first domain refers to the age group that we would like to investigate. The second domain refers to the condition that we would like to involve. The third domain refers to the neurodevelopmental outcomes. And the fourth domain refers to the biomarkers that we would like to involve. We conducted our search in 3 databases, and you can see the results here. So here you can see my selection progress. We started with more than 7,000 articles, and after the duplicate removal, the title abstract selection, and the full text selection, we ended up with 265 articles, and the citation chaser part revealed an addition of 8,000 articles, and we're currently working on the selection of these articles, as you can see here, and we will move forward to the data extraction soon. So let's move to my second project, which will, as I've mentioned earlier, will focus on the predictor accuracy of different biomarkers for predicting delayed language development in children with neonatal encephalopathy. It will be a single-center retrospective cohort study, while the first project will be a systematic review and a meta-analysis. And we named this study the SANE study, standing for Speech of Kids After Neonatal Encephalopathy. So despite the fact that we can acquire our native language pretty effortlessly and easily, at the age of 5, 7 to 8% of the children are diagnosed with developmental language disorder. Language is a pretty important cognitive skill in our life because we connect it through it to each other, and it's also really important to achieve our academic goals. So language has a huge and robust influence on other cognitive domains as well. As I mentioned earlier, neonatal encephalopathy affects 0.5 to 3 per 1,000 live births in high-income countries, and some studies revealed impaired speech and language difficulties in these children, even though they had a good neurological outcomes. So the currently available biomarkers may predict whether the given child will have a good or a bad neurological outcomes. However, there is not a detailed exploration of the domain-specific predictions in these children, even though they had a good neurological outcome. Based on this information, our aim is to find the most accurate predictors of language deficits in children with neonatal encephalopathy. Our clinical question is that what's the most accurate prognostic tool for predicting delayed language development in children with neonatal encephalopathy, and our population again is children with neonatal encephalopathy, and the prognostic factors that we would like to investigate are the MRI on an special highlight on the diffusion abnormality of the corpus callosum, the amplitude integrated EEG, and the blood gas markers. Here, the outcome will be the prediction of language deficits. Our hypothesis for this study is that the corpus callosum MRI quantified diffusion abnormality will provide the most accurate prognostic prediction of language deficits in these children. And similarly to my first study, we hope that our results would lead us to early early predictors and intervention based on these predictors. So the progress of my study is that we specified the inclusion and the exclusion criteria for this study. We also selected the neurodevelopmental tests and the additional questionnaires that we would like to measure, and we submitted the ethics approval, and currently we are waiting for it to be accepted to start the data collection. So I would like to summarize my progress. I would like to submit my first paper at the fall of this year, and I'm planning to submit my second project at the spring of 2027. I would like to end my presentation with a Murakami Haruki note that it's all a question of imagination. Our responsibility begins with the power to imagine. And thank you for your kind attention, and thank you. I would like to say thank you to my team who helped me through this journey. Thank you.
Your first project, you mentioned quite a few biomarkers. Based on the full text selection, what is the most widely used biomarker in your text?
Based on the literature, I would say the MRI and the amplitude integrated EEG.
I may have missed it, so maybe you have mentioned it, but may I ask if what was your in- and exclusion criteria in your meta project?
Mm-hmm. So we only included those articles when the children went under therapeutic hypothermia and were born on term. And we also only selected those articles where the neurodevelopmental follow-up was at least 18 months.
Regarding your second study, what data do you base it upon? What is already available in the literature?
Mm-hmm. I actually have a supplementary slide for that. So here you can see the previous steps. So we are working with a cohort of children who were treated as a newborn at our clinic with therapeutic hypothermia. And the first days of their life, they measured the arterial blood gas markers, and at the age of 4 days, they underwent MRI scans, and during the hypothermia, they were also measured with amplitude integrated EEG. And when at the age of 2 years, they were also measured with the Bailey test, which is a widely used neurodevelopmental test for these children. And currently, my PhD will focus on the 4 and the 7-year outcomes of these children, and we will measure the neurocognitive data. So this is the already available data for now.
My question is that you mentioned that you included only the patients who underwent therapeutic hypothermia. So my question is that, do you have any information whether the not that severe birth asphyxia patients has also some disorders in the future? Because these very severe patients are followed up, but the mild ones, they are not really followed, and maybe it would be very important to to look at their future as well.
I think that my second project can be relevant to your question because as I've mentioned, we would like to investigate the domain-specific cognitive outcomes on the children, and at that study we will mainly include those patients who had good neurological data. So we will investigate this question too. So yes.
Thank you very much.
Thank you.
Regarding your second project, I would like to ask you what kind of neurodevelopment tests, tools, or maybe questionnaires are you planning to use?
I also have a slide for that too. So here you can see that we will work with two main neurodevelopmental tests, the VPPSC, which is a widely used IQ question test for this age group, and we will also use the COBAC test, which is really new. So it was released this year, and it's a comprehensive language test for the Hungarian language, which examines the different part of our language skills from the expressive or the receptive language subscores, for example. And we are also planning to involve several parental questionnaires, so for example the socioeconomic status questionnaire or the strengths and difficulties questionnaire, and also some ADHD and autism related questionnaires too.
I would like to ask you, in the first project you mentioned MRI and AEG, and the second project also the blood gas parameters. Yeah. Why is it missing from the first project? Why don't you check if it is a predictive factor for the early blood gas parameters? If I understood it well. So this is it your second project?
Yes, this is the second one.
But in the first one, in the hypothesis, I have seen only MRI and AEG, and not the blood gas parameters. You don't want to check it in the meta-analysis, or you will? We
also want to check it, but we hypothesize that the MRI and the amplitude integrated EEG will be most accurate, more accurate than the blood gas markers.
Okay, thank you. And another question, I understand that it's the advantage of the early prediction that we push to the early intervention harder if there is a bad prognosis. But I ask you as a psychologist, what do you think? Is it good or bad for the parents to have an early prediction of their child's development? Actually,
I think that it's really important. So in my second project at the parental questionnaires, you can see the Jaworski questionnaires, and they made a research about the parental concerns of their children. It was focusing on the premature babies, but I think it's also important in our study as well. And they found out that the parents would like to have detailed information about their child's condition.
That's my everyday experience. They always ask, what's the future? But I ask you, your subjective opinion, that is it good for them if you have, for example, a bad news, a very early bad news, that okay, this is very bad predictive factors, and we don't accept too much development?
Yeah, I think that by providing this information to them, we will give them control upon their situation, which can be like pleasing to them, to have control, and they can attend speech therapy, for example, with their children. And so I think it's really important to give early intervention.